Thank you so much, Congressman Carter. Thank you for your leadership as a community pharmacist. You and I have worked together in different cities, but are the same projects trying to help patients out. And here we are gathered in Congress now for the same purpose. You know, I thought I might talk about Alzheimer's disease for a little bit this evening. It's hard to imagine, but over 5 million Americans have Alzheimer's disease. And I bet there's not a person in this room, a person at home watching that doesn't have a loved one that they've watched them suffer and go through the stages of Alzheimer's disease. 5 million Americans. And it's hard to imagine in 3 decades we're going to have 14 million Americans with Alzheimer's. For the sake of humanity, we need a drug to cure this. And you and I both know that we're truly this close, that there are medications in the pipeline that are going to help treat Alzheimer's. The economic impact of this disease on our country is also extraordinary. Right now, we're spending about $300 billion a year treating Alzheimer's patients. Again, in 3 decades, it's going to be over $1 trillion a year. A medication that would cure Alzheimer's is going to save this country literally trillions of dollars. When I go back home, people ask me a couple things. Number one is they want us to lower the cost of health care, lower the cost of prescription drugs, but they also want us to balance the federal budget. If we're ever going to be able to balance the federal budget, we have to start driving the cost of health care down. And innovation is the way that we're going to do this. I hope everybody understands that the Democrats' H.R. 3 does just the opposite. By their price fixing, they're going to stop innovation. Drugs that are going to cure Alzheimer's are never going to come. And I haven't even started talking about hepatitis. When you and I were in college and in medical school and pharmacy school, there weren't cures for hepatitis. But now we have vaccines for it. Hepatitis C was a death sentence. Now we have medication. A medication, take 1 pill a week for 12 weeks, 95% cure of hepatitis. So that patient that was going to end up with a liver transplant that was going to cost $500,000, we've cured them with an outpatient medicine. I think about all the cures for cancer, CAR T-cell therapy, new innovations out there, spinal muscular dystrophy, so many things, cortical blindness. For the sake of humanity, we cannot let H.R. 3 happen. We need H.R. 19, the Lower Cost and More Cures Act. That's what's going to drive down the cost of health care and bring great solutions, great new innovation to this country. And again, Congressman Carter, thank you for leading on this very important issue.